Vicky said I'm a clinical psychologist, so that's my kind of professional hat. I'm a parent of 3 grown-up children in their 20s, and I'm the caregiver for my husband who has glioblastoma. He was diagnosed just coming up to 2 years ago, and I've been a member of the Facebook group, so you might have seen my name floating around online there, just participating and getting the support for myself as a caregiver, just like all you guys do too. So I kind of bring my personal and professional hats with me tonight. Okay, let me see if I can bring this up for you. Whoops, sorry. Now, you need to somehow signal to me that you can see that. Or maybe Vicky just, because I can't see all of you, I can only see a few of you. Yeah, you're all right? And you can hear me?
Yeah, that's all good.
Cool,
yeah.
Brilliant. So you can see I've called this, it's okay not to be okay when you're living with a brain tumour diagnosis. This is kind of the group that you never wanted to belong to, but through no fault of your own, you are part of it. And you are either a caregiver, I don't know if we've got any patients with us, people who actually have brain tumours this evening, but whether you are either way, it's kind of a pretty tough road that we're all journeying along. And so from my point of view, it's pretty normal and very okay if you're actually not feeling particularly okay. So what we're going to be talking about this evening is just what do we do about that? So these are some of the things I thought might be useful for you to talk about, but of course we can expand on some things in the second half. So just talking about what's it like in terms of your well-being and resilience, getting a diagnosis. What does it mean when we talk about well-being? What is mental health? What if we want to actually access and seek help? What about our kids and adolescents? Some of them may be struggling. What do we do about that? What about if one of our children is the patient? And just thinking really, how do we build and strengthen our resilience, thinking about self-care. And I'm trying to make sure that I've added in some really practical things you might be able to take away for you to try in terms of your resilience and maintaining your well-being. And then we'll finish with questions. So I guess the first thing to say, it kind of feels like telling you the obvious, but the first thing to acknowledge is the significant impact of what you're going through, of your experience and the shock and the horror of a diagnosis of a brain tumour. And it's the impact really that we need to think about is not just about one person being the patient, it's also for the caregiver. It's for the family around the patient and the caregiver. It's for the wider social relationships around the family. It's about our roles. It's about who we are as people, so our identity. Also, our working life can be really disrupted, and of course, parenting. So it's just really to start off with that context to remind ourselves how huge and significant and kind of multi-level this impact is. So just thinking firstly for patients themselves or people who do have brain tumours, the first thing, and this will be something which will be very familiar to most of you, it's the kind of enormity of those immediate losses that you experience. So most people lose their licence. There's also the significant loss often, and this can vary for everybody, in actually how your brain works. Depending, as you know, where the tumour is in your brain and how it's functioning in terms of impacting what you're able to do in everyday life, and that can be really significant. And as some of you have probably found, the patient isn't always aware of those changes in brain functioning, and that can just be an added layer of complexity for those around them. The reduced independence is huge. I know certainly for my husband, that's been a huge thing, not being able to drive, not being able to go around doing his own thing. He's dependent on other people, and that's had a huge impact on how he feels. Loss of employment is obviously significant, and that brings, of course, with it the financial stresses along with the loss of identity. So if part of who you felt you always have been as someone who works and brings in income as a provider, that's a real shift. So there's these real immediate losses that happen for patients. But there's also other stuff. There's also kind of the symptoms, if you like, or the reactions which come after the immediate losses. So the research suggests that kind of having to accept that you have a life-threatening illness or a life-limiting illness essentially functions like a trauma. So trauma in the sense that like if you've been to war and you've witnessed horrific things and you come back and you still have ongoing experiences, or something like the Christchurch earthquake, a lot of people had experienced that as trauma. This experience, not just for patients but also their families, can be regarded as a trauma in terms of how people react. You'll be aware there's also all the other symptoms which come again from the impact on the brain. So that increased emotionality and reactivity is a big one. So I think doctors often describe it almost like if you've tended to be, say, a little bit casual or relaxed or a bit reactive, then it's just more extreme. So whatever emotional level experiences you typically show are just more extreme than they were previously. And that brings a lot of challenge with it. The poor sleep is a big issue, and that can be both physiologically and also because you're stressed and worried, which obviously stops or can impact a lot on your ability to sleep. Living with pain is huge and significant. All these things impact your psychological well-being. So your mood can really deteriorate. You can have a lot of anxiety and fear. Obviously, there's the grief around what you've lost, and the anticipatory grief, which is a new kind of term I learned when I became part of this GBM community, the brain tumour community. You know, the fear and the worry and the grieving about what is going to come rather than what has been immediately lost. So that's significant. And obviously the relationship changes that can come along with that as well are significant because of that loss of identity, loss of functioning. So the way that you relate to other people is different, and a way they relate to you can be different as well. So real significant changes for patients. So this is kind of, this little picture here is just a bit of a reminder that the experience of having a brain tumour illness or having a brain tumour diagnosis kind of brings in psychological, sociological, so your social environment and your biological components. It's a complex issue, coping with having a brain tumour. I've just put a couple of comments there, which I thought were quite interesting. Doctors often prescribe medication to address the mental health issues that come along with a brain tumour. And in fact, 50% of patients with brain tumours or malignant tumours are put on antidepressants. A lot of antidepressants have a dual role of addressing not just mood but also anxiety, and that can be quite helpful because, as I just mentioned, the anxiety can be a really big factor in how you feel. But this, you know, the research does emphasize that medication isn't everything. It doesn't solve everything, and other things can be important. I'll talk a bit more about those in a moment. And remembering, this is particularly important for the patient, that it's easy to feel like you've suddenly become the diagnosis or become the cancer or become the tumour. And it's really important to remember that there's more to you than just that. So caregivers, I'm assuming probably most of you are caregivers. So this will not be a surprise to you, this kind of information. And this is what's come from the research around cancer patients and their families. As you know, you don't get any preparation for this. You just kind of suddenly are in this caregiving role and it just comes out of the blue. All the research suggests that, in fact, the well-being and quality of life impact for the caregiver can be even more significant than the patient. It kind of sounds a bit strange to say that, but the researchers have found that because patients have the treatment pathway that they're going through, they kind of have a focus, even though it's incredibly difficult and traumatic and stressful. Whereas caregivers, their quality of life tends to be significantly impacted because they don't have that specific focus. All they're doing is being the person who is hopefully caring for and looking after the patient, and that in itself is incredibly difficult. So there's all the chronic stress, the huge anxiety, the incredible shock and trauma that comes from that initial diagnosis. I mean, who ever thinks that they or someone they love will get a brain tumor diagnosis? It's not something people think about. So the shock of that, and as I said before, the trauma is huge. The tricky thing, and this has certainly been my experience, and I don't think it's intended by doctors, but often doctors don't consider the caregiver's roles or caregiver's needs during the treatment pathway. And that I found was quite tricky to navigate when we're going through all of these experiences and yet they're not really named or acknowledged or addressed. And that's where an organisation or a trust like the Brain Tumour Support Trust is so critically important. And I've certainly made good use of the support that I've had through the Facebook page and just connecting with other caregivers. Without that, I think I'd feel quite isolated and alone in this. Yeah, it's good. When we were at our oncology appointment the other day, it was nice to see a brain tumour support brochure up on the wall in the doctor's office. I thought, well, that's a great start. The other change for caregivers is the change and adoption of a whole lot of new responsibilities in your life. So all of a sudden you might become the person who's doing all the communicating with the doctors, or monitoring symptoms or side effects, arranging appointments, trying to be the advocate for your loved one, and also meanwhile trying to provide emotional and physical support for them as well. A whole lot of extra decision making that you probably didn't have to do before, around advanced directives or around treatments or around, are you supposed to be looking for clinical trial information or any of that? All those things are quite a lot of pressure that's new and different for caregivers. And that last one I've already mentioned, financial stress can be significant, and even more so if financially things were stressed to begin with, and then on top of that you've got another layer of managing this traumatic event. So just thinking a bit more broadly for families as well, all the roles can shift. So in a family, for the elderly, the older generation, or the children, the roles and the parenting roles may shift quite a lot as a result of a brain tumour diagnosis. I've already mentioned the financial stresses. Sudden change can be really scary for everyone, particularly for children, and they don't always understand what's going on. So that can be really confusing and scary and worrying. This kind of event also really highlights the differences in the ways that people process information and emotions and cope with stress. Everyone does that differently. And something like this is like this bombshell that comes into a family, and you really see how everybody is so different. Some people like to talk a lot about how they feel and kind of process things verbally. Some people just want to internalize things and just kind of that are not comfortable talking about it. They just want to really work through it themselves, and that's all okay. But what becomes evident is that all the differences are very obvious. Children in particular can really struggle with all the changes in routine. So you're going to radiation treatment, or you're having meetings with the doctor to talk about chemotherapy. All of these different things can change routines, and children often find that hard. And they always know something's going on, even really little kids. We can't protect them from that, and we shouldn't even pretend that everything's fine when really it's not. I'll talk a bit more about kids a bit later. So I guess what I'm trying to say, all of this stuff is going on, and in the midst of that, we all need to be thinking about our own well-being. What does that actually mean? These are just some examples of things which the research suggests are really important to help us navigate through this difficult time. So as you can see, this list, they're all really simple things. They're all things you probably already do and think about. but it's being a little bit more mindful and intentional about using them to make sure they support your well-being. So regular exercise, that doesn't mean you have to go to the gym every day. Just a simple stroll around the block or just getting outside is really important. Healthy diet and sufficient sleep as much as you're able to is really, really important. The research suggests that just moving around rather than sitting can be important. If you have a job and you're still working that involves sitting and looking at a computer screen, really important to keep moving. Your well-being depends on your body having a chance to move and not just be sitting all the time. Getting outside into nature has been one of the most important things that researchers have found make a big difference to our well-being. Partly it's the kind of the exercise and getting outside and moving your body around, but there's something about being in nature which is nurturing for our well-being. Obviously, having good social supports around you is important. As much as you're still able to do the things that you enjoy or give you that spark of enjoyment and kind of normality is important. Experiencing new things and learning. So whether you decide you want to go, and Vicky was talking about going to yoga before, whether you want to start learning yoga or whether you want to, I don't know, learn an instrument or something. Doing something new and different that stimulates your brain in a different way helps you be distracted away from the worrying, scary, confusing time that you're going through. So those are just some things that really do help our well-being. So just thinking about mental health, what do we mean by mental health? I've just put a couple of statistics in there and you can get more information about them if you want to. They just come from the New Zealand statistics, the government statistics department. And it just puts things in perspective, really. 10% of the population say that in any 1 month, they would experience psychological distress. So 1 in 10 of us, regularly feel pretty distressed about their mental health. And over 20%, so that's 1 in 5 of us, are diagnosed with either an anxiety or mood disorder. So mood disorder is kind of like depression or low mood. So that's a lot of people. 1 in 5 of us have significant mental health issues. So it kind of puts in context that this is really common and that we need to be thinking about looking after our mental health. So again, it's okay not to be okay because a lot of people are struggling. It sounds obvious, but we need to just remind everybody that actually reaching out for help is important. You don't have to struggle on your own. Whether you're a caregiver, a patient, child of somebody who's got a brain tumour, reaching out for support is important. And that's for all family members. Working in the public health sector, we certainly see people under a lot of stress, a huge level of kind of demand for mental health support at the moment. And coming through post kind of COVID, I think people held together a lot during that, and particularly now I think people are really, especially anxiety is a bit of a pandemic of anxiety, if you like, and it's important that you don't struggle on, that you reach out for support. A brain tumour diagnosis is distressing and can be traumatic, as I said before. Learning to adjust to the new normal actually takes time. So don't expect yourself to just spend a couple of weeks being worried and then being all fine. It actually takes time for you to adjust with what is happening in your life that's changed and different and really hard and challenging. That last one is important too, just remembering that adjustment is different depending on whether you're the patient or the family or caregiver around them. So how do you know when you should ask for help? I mean, this obviously is different for everybody, and there's no suddenly, okay, you definitely have a mental health issue and you definitely should get help. It's really a continuum of at what point do you feel you're not able to cope in your life? At what point do you feel you're not able to kind of function? So those are some questions I've put there just that you can think about if you're wondering whether it would be good to seek help. Can you generally complete your normal day-to-day stuff? Like, can you take your kids to school, or can you get to work and do a reasonable job? Can you empty the dishwasher? Can you do just the ordinary bog standard daily activity things? If those things are a struggle for you, it's probably time to really reach out and get some help. Do you feel distressed during the day most of the time? Do you feel that you just can't cope with basic day-to-day living? And of course, if you're feeling unsafe or suicidal, that's really important that you reach out, speak to someone that you trust, and reach out for professional help as well. I'll come back to this one, but I just thought I wanted to add it in there just to show you how many different things and ways you can get help if you're feeling that your well-being and your mental health are at risk. So as you can see, there's lots of different ways you can text, and you get someone who's trained in mental health to text you back. There are lifeline, helpline, phone numbers. There's also apps now that you can go on and kind of just be self-directed and working through well-being and mental health issues. Obviously, talking to your GP, a lot of people just feel like they're a really good touchstone and know you the best, so they're a good person to talk to. Obviously, there's the private sector where you can go and see a counsellor or a psychologist, or the public mental health system as well, which you normally have to access through your GP. These are just a few things to add in terms of what you might be offered if you did ask for help. So things like relaxation and breathing is really helpful, particularly for anxiety. Mindfulness is really common and helpful. Meditation, cognitive behaviour therapy, and acceptance and commitment therapy. If you hear those terms, they're really common and well evidenced to be very helpful. We can come back to these if you want more detail on any of that. So just thinking about kids in particular, and this is children and teenagers, adolescents, it's really important to just be straight up with them about what's happening. Be honest, be clear and open. You don't have to hide things, but make sure that the information that you're sharing is at an age appropriate level. So what you might say to a 15-year-old will be quite different from what you'd say to a 4-year-old, of course. They'll know something's going on, and you may as well be open and honest with them. Acknowledge how you feel, acknowledge how they might be feeling. Teenagers, as you're probably aware, if you've got children, tend to connect with their friends if they're concerned about something. So allowing space for that, and don't be offended if they'd rather talk to their friends than you. That's really common. Just be available for them to talk to you about how they're feeling and to ask questions. I would, particularly with younger kids, don't worry about giving them too much detail. Wait for them to ask the questions. Showing your feelings is okay as long as you're not kind of overloading them or overwhelming them with your feelings. You can just name how you're feeling, that you might be feeling worried, for example. If your child is a patient, again, they're going to be having their particular experience just as a child, but they've got this extra layer of this strange, confusing, probably scary thing that's happening to them, and everyone around them is feeling worried and scared. So making sure that they have some space as much as possible to just be a kid is really important, to do fun stuff. If they feel, if you feel anxious and overprotective, that is absolutely super normal, and you'd expect that. Being available again for questions for them is going to be important, and remembering how old they are. If they're 3, you're going to keep things pretty simple. If they're 15, they're going to want a little bit more detail around what's happening to them. I said this before, kids know when adults around them are upset, so you don't have to hide it. But again, don't overwhelm them with the enormity of how you're feeling. You can just name, I'm feeling really worried about this. That's okay. Modeling the small ways that you use to cope, whether it's just taking deep breaths or going for a walk or something that you do that is kind of soothing and helpful for you. You can share those, and that's really good for kids to see that you are modeling that. It's okay to set limits, even if your child is the patient, that's okay. Just being realistic about what to expect probably needs to be adjusted a bit. And again, the routine is important for children. I don't know if you can see the your own faces on my screen. You probably can't, but I'm just moving you around a little bit. This is just a funny kind of, this came off the internet, but it's a little bit of a funny reminder that Kids are complex little beings, and we tend to think on that left circle. So what people think about why kids do what they do, usually people think, oh, they're just being naughty or they're just doing it on purpose. But actually, that right-hand circle is probably more accurate. There's a whole lot of stuff in behind why they're doing what they're doing. So whether they're a patient who's going through treatment themselves, or they're kind of observing their parent or their sibling who's going through a brain tumor treatment, there's going to be a whole lot of stuff going on for them behind the scenes. It could be something to do with them being anxious. They could be tired and exhausted. They might just really feel like they need to connect with you, and they're feeling a bit disconnected. So I guess this is just really saying, don't assume things are just simple. For kids, things tend to be complex, and you need to just remember that there's stuff behind what's going on for them. And this is just another funny little picture. What might they be feeling behind their behavior? Kids behave as the way to kind of reflect how they're feeling. So things like tantrums are more likely to be, I'm overwhelmed, or I'm trying to learn a new way to cope with big feelings, rather than you're mean, you're a horrible parent, or I'm manipulating you. So those are just a couple of things that came off the internet, which I thought were quite a good summary. And this is teenagers. I think really it's just the same kind of themes, being open and honest with them, allowing time for them to connect with their friends. Sometimes they might withdraw or be aggressive or even reject your attempts to connect. So just moving on now, I'm just aware of time. Just want to talk about resilience. Resilience, this is a definition which came from some recent research, is an individual's ability to maintain or restore relatively stable psychological and physical functioning when confronted with stressful life events and adversity. So clearly, a brain tumor diagnosis is a hugely stressful life event and adversity. So resilience is not your ability to not feel anything, but just to kind of bounce back after you've had something stressful or traumatic happen to you. So if you think about a seesaw as kind of a way I always think about it, if you think about stress and trauma and change and shock kind of weighing down the one side of the resilient seesaw, what you want to do is make sure that there's plenty of other positive resilience building things happening on the other side of the seesaw to build up your ability to cope and manage and maintain your well-being. So this is just an example of some of the things you might want to be thinking about. Resilience is not just one factor. Could be physical things like remembering to eat well, a bit like that list as I showed you at the beginning around well-being. Remembering to get some sleep, checking your health, eating well, resting, that's really important. Emotionally, all those things are really important. Finding ways to calm, regulate your emotions, focus on the positive, they're all really important, along with spiritual and mental as well. So it's just really a reminder that there's quite a lot of different components of resilience, and it's important to think about all of them. Managing change and coping with change is part of this as well. If you think about getting a brain tumor diagnosis, you're kind of having to manage a huge change, and how much of it you can control or not is a useful way of thinking about it. So you can see on this little picture, the things that I can control are on the inside circle, and the things that I can't control around the outside. So what others think of me is not something I can control, but I might control my response to other people's behaviors. Or I can't control what other people think or perceive, but I can control kind of what time and energy I put into things. So it's kind of interesting to just remember there are some things in your life you can control. How you let others affect you, whether you forgive someone or not, what boundaries you might set around them, is all things you can change and control. But there's a heck of a lot of things in life which we can't control. We can't control the result on that jolly MRI scan. We can't control what is happening inside our brains within reason. So part of resilience and thinking about your well-being is just being mindful about what you can and can't control, and not getting too stressed about or spending much time on the things you can't control, because that's a whole lot of wasted energy. I don't know if any of you have heard of Dr. Lucy Honey. I'm not even exactly sure that's the way you pronounce her name. If you're interested in listening to her, she's got some YouTube videos, and she produced one called 3 Secrets of Resilient People. And these 3 strategies I use myself ever since I've started reading her books and watching her online. And I just thought this is a really interesting and valuable thing to think about in the context of how we're all navigating our way through this brain tumor journey. These are 3 simple strategies you can use that will help you feel more resilient. So this first one is remembering that suffering is part of all human existence. Horrible things happen. Life can be horrible sometimes. So it's important to remember that and not get trapped into feeling like you've been targeted unfairly, or that it's a why me? Why did this happen to me? Horrible, tough things happen to a lot of people, unfortunately. The second one is to remember to notice the good. This sounds kind of simple, but actually it's about being careful and intentional about where you put your focus. We tend to be really good at noticing the tough stuff, like when we were back living in the cave as cavemen, prehistoric times, we had to be aware and notice that there was a saber-toothed tiger out the door, right? Or else we'd probably not survive more than a day. We have to remember the hard, negative, difficult stuff. But did we notice that there was a rainbow in the other direction? Probably not. It's more important that we notice the tiger. So don't be overwhelmed by the negativity. Noticing the positives and the good stuff in your life, not just the hard stuff, is really important. So yes, it's horrific and horrible and unfair that we're all living with a brain tumor, but we've also got other positive things in our life that are important to remember. So do you have children, or do you have great friends, or do you have some amazing things that you do in your private life with hobbies and activities and sports? It's really important to focus and notice and give attention to those as well. The last one is really important. Stay in the driver's seat of your life rather than just reacting. So an example is kind of, if you're about to do something and you kind of pause briefly, be conscious about why you're doing what you're doing, and ask yourself, is what I'm about to do or think or say or want to do going to help me or harm me? So even if it's something as simple as having the 3rd glass of wine or something, is this 3rd glass of wine going to help me or harm me? It's just a really simple little exercise and super helpful. I mean, that's just a silly example with the wine glass, but you know, you can be using these 3 to be intentional to build your resilience. Thinking about your attitude so you don't feel like you're in a why me kind of zone. Remember to focus on the good stuff as well as the negative, and really being intentional about what you're doing and whether it's helpful or not for you. I'm sure you've all thought and been told to be thinking about self-care. As a caregiver, it is really important. It can just feel like another thing on the to-do list, but actually, if you don't look after yourself, who is going to do that? And if you fall over because your well-being isn't looked after, who's going to be looking after the other people around you? Keeping it simple doesn't have to cost things. You don't have to spend a whole lot of money. As much as, I don't know, getting a flight to a Pacific Island would be great, it's not kind of practical for everybody. There might be simple things that you can do every day, small self-care things, and everyone is going to be different. So just have a bit of a think about what might work for you, whether it's just going for a walk, getting a massage, meeting a friend for a chat, any of those things. Be intentional about making sure you carve out time each day for something just for you. This is just another, we're just about finished. I'll just give you this little exercise as well in terms of another thing to take away. If you feel that you get stuck in your difficult feelings or thoughts, so they might be worry thoughts, they might be overwhelmed thoughts, they might be feeling really crap and low and depressed, first thing to remember is self-compassion. It's okay. It is just a feeling, and feelings do come and go. Trying to push away hard feelings often makes them actually grow. So just kind of noticing them and naming them and allowing them to be there can help manage them. Practice just noticing them and accepting them, almost like a kind of a curious observer. So you might, oh, that's that blimmin' worry thought back again. So you just kind of consciously noticing it. Try not to judge your thoughts rather than saying, oh, I'm feeling depressed again. It's terrible. You know, why do I always do that? I'm such a stupid person, or whatever it is that you do. Try not to judge yourself. It's just a feeling. Trying being in the present is helpful rather than worrying about what has happened in the past or what will happen. I'm the worst one for this. I'm always thinking about the future and worrying about the future and jumping 10 bridges before I get to them. But I really try to be mindful about staying more in the present. That last bullet point is just one way you can do that. So if you find yourself kind of spinning away or just getting super anxious and worried about things and you just can't even function well, this is called grounding, where you just do this simple exercise of just taking a pause for a moment and looking around you and noticing 5 things around you. So I might decide, okay, I'm just going to close my eyes for a moment. And when I open my eyes, I'm going to notice 5 things in the room with me here that are red. It sounds like a super simple thing, but you're just, all it's doing is focusing your brain on the here and now, rather than whizzing off into the future or the past. This is just a really cute thing I thought was really nice and something to remember. Am I broken? Asked Rabbit. No, said Bear, you're healing. Healing can be messy and it takes time. Sometimes it might feel like you're broken, but that's just a rough edge being smoothed as it grows and fits into a new place. Soon you'll be stronger than you were before. And this is just my last thing, really. You can't do this alone. Reach out for help. There are people and services available if you need it. And doing it with someone else is going to make a big difference.